We're fortunate enough to have Dendrion, which is a company that makes drugs for prostate cancer. They're helping sponsor the event, help bring the food and everything. And we're just going to talk a little bit about one of their new, actually I shouldn't even say new now, it's been out since 2010. One of their treatments for prostate cancer is actually an immune therapy. It uses your own immune system to fight prostate cancer. Then I have a little presentation on testosterone. And testosterone and prostate cancer used to clash. They would never get along, and in certain areas of prostate cancer they still don't get along, but we're learning more and more that it's actually not only safe but potentially beneficial for men to pay attention to their testosterone and replace it if need be. But we'll start on the what's called Provenge, and Provenge again uses your own immune system to generate a response against prostate cancer cells. Okay, and right now it's been approved in patients who have more advanced forms of the disease. So what Provenge does is right now it has an indication. It's for what we call metastatic disease. That's for disease that's already started to spread into the bones. And it's also for disease that is no longer responding to our first line treatment, which is hormonal therapy. Hormonal therapy is when we give medicines that actually cut your testosterone. That's the case where testosterone actually is not good in these advanced states. So anyways, Provenge works a little bit different, works way differently than other drugs up to this time on prostate cancer. All the other drugs we have right now work by killing. They work by attacking the cancer. Provenge actually uses your own immune system to try to counteract and fight the prostate cancer. Just like a child who gets a flu for mumps, gets their immune system stimulated so they can fight off that virus. With prostate cancer, you probably know that it affects many men, 1 out of 6. Not 1 out of 6 people will die of it. Not everyone needs treatment for prostate cancer. Some people may die of other causes before the prostate cancer catches up with them. But if people have surgery or radiation, I think this number is a little bit overstated, but historically 1 out of 3 patients who needed to get surgery or radiation ended up having a recurrence. I would argue that with current treatments, that number is probably 1 out of 5. So it's still not insignificant, but some people may need more treatment if their cancer returns. And what do we do? Well, if you've gone through surgery, you've gone through radiation, the next step is hormones. And with hormones, eventually, if you live long enough, hormones will fail too. And at that point, all we had in the past was chemotherapy. And chemotherapy is something that is basically an injection you take, a fluid that kills everything that multiplies in your body. And prostate cancer, or cancers in general, since they multiply quickly, are more likely to be killed by the chemotherapy. And that's how it works to fight the cancer. But as you know, it can devastate that person as well. Your hair can stop growing, it falls out, your nails go brittle. So there's a lot of potential side effects with chemo. With Provenge, it's the first FDA-approved drug for prostate cancer. And what it does is that there's immune cells that normally are activated, recognize viruses, bacteria, foreign objects, and can mount a response. But with Provenge, with regular prostate cancer, your immune system may not recognize the cells, and that's how these cells keep growing. Your immune system needs to be activated so it can recognize prostate cancer cells, and that's basically what this drug does. I have a video that'll kind of show you how the whole treatment process works. But a good analogy that company uses is that it's basically a coach teaching your immune system how to tackle and beat prostate cancer. In the clinical study that they did, men who were treated with Provenge were more likely to be alive than men who were not treated with Provenge. You can see here that over 1, 2, and 3 years that the chance of you being alive compared to not getting it increased year over year. So the longer you had the disease, the more likely you were to survive if you got Provenge. And one thing that's different is with prostate cancer, usually we're always worried about, well, what's our PSA? Is it still 0? Or, if, God forbid, it starts going up, what's the value? What's the value? With Provenge, it's an immune system drug, so, when you stimulate your immune system, you don't fight that cold the next day. It takes time. And that's the same sort of concept that you have with immune therapy with Provenge. We actually don't even really pay attention to PSA for at least 6 months, because I think it takes at least that long before you can decide if it's working or not. The nice thing about this kind of drug is with immune therapy, it's really just like flu-like symptoms you might have. Some people may have some shakes or a fever. It's given in the office. It's an IV drug. It's nothing like we have to worry about with chemotherapy. You don't even have to stay in the office. It's just the amount of time it takes to deliver the drug. And usually that's about a 2-hour process, and you do it 3 times. And the 3 times occurs over the course of a month. So in a month, you can be done with the entire therapy, which also is very good as far as patients are concerned. You can see here most people were able to finish the drug. Only 1.5% of men had to discontinue due to side effects. The way it works is we actually use your own blood. So you come into a center here in town where they do what's called leukapheresis. They take the blood, and then that blood is transported, and there's a few different facilities across the nation that actually will process the blood and stimulate it. They expose the blood to prostate cancer cells, and your own blood cells then develop activated T cells. They're called antigen-presenting cells. Then, once that formula has been finished, it comes back, and you come into the office. It's a 1-hour infusion IV. It's a half-hour to prepare, half-hour to watch you afterwards. So in 2 hours, basically, you're done. And it's 3 cycles: blood draw, blood given back, blood draw, blood given back, and again. So 3 times can be done within 6 weeks. But since this is the first drug in its class, right now it's fairly expensive. But they've done a really good job with setting up foundations, working with insurance companies to make sure if you're a patient who needs it, that you will get treatment. They have various numbers, assistance protocols, again, that can help. Again, this is not something that's, this is actually an FDA-approved drug. It's what we call a Category 1 recommendation. NCCN guidelines is a cancer guidelines organization, recommends it after patients have started to fail hormone treatment and they start having spread to the bone. That's when you could potentially be a candidate for a drug like Provenge. So I want to show you a video. So this shows you how the blood is taken from your body and then is presented to what we call antigen-presenting cells.
Specialized antigen-presenting cells, or APCs, act as a key component of the immune system.
This is your own blood right now.
The engulfed agents are then processed into fragments and presented as antigens on the surface of the APCs. Upon maturation, the APCs activate T cells, which proliferate and attack cells that express the original antigen.
This is also part of your bloodstream. This is a T cell which now has been programmed to start fighting bacteria or viruses. It's just kind of showing you this is the normal mechanism.
But prostate cancer is an immunoevasive disease. Prostate cancer cells can evade or inhibit the body's normal immune processes. This immunoevasive ability helps make it possible for cancer cells to grow and spread largely unchecked. ProVeg works differently than other approved prostate cancer therapies. With ProVeg, the patient's immune system is activated to target and attack prostate cancer cells. The creation of a patient's personalized dose of ProVeg begins with leukapheresis to extract immune cells, primarily immature APCs. Then, at a ProVeg manufacturing facility, the cells are cultured with a recombinant antigen, PAP-GM-CSF.
These are actual prostate cancer cells
expressed on more than 95% of prostate cancer cells, while GM-CSF, an immune system activator, supports APC maturation. As the patient's APCs engulf and process the recombinant antigen, they begin to mature and present the antigen on their surface. This processing occurs outside of the body to support APC activation and maturation by removing the cells from
these are activated and, like the video is saying, these will be infused back into your body.
After 2 to 3 days, the fully mature APCs have become ProVeg.
Kind of scary to have that going in, but it doesn't hurt.
When the dose is ready, it is transported to the physician for infusion. Once in the patient's body, ProVeg activates the patient's own resting T cells and induces their proliferation. Activated T cells are one of the immune system's strongest defenses against cancer cells. ProVeg-activated T cells are able to recognize,
These cells
target,
activate
and
detect
attack
prostate cancer cells.
antigen-expressing prostate cancer cells, resulting in an immune response against the cancer cells. In the pivotal Phase 3 clinical trial, ProVeg extended median overall survival beyond 2 years in patients with metastatic castrate-resistant prostate cancer. In this study, the sustained immune response to ProVeg was seen up to 26 weeks, the last time point measured. ProVeg has an NCCN Category 1 recommendation for first-line treatment of men with asymptomatic, minimally symptomatic, metastatic castrate-resistant prostate cancer. Activate the power of your patient's immune system. Treat first line with ProVeg to extend survival.
Once you've had your prostate removed, okay, and say 10 years from now, you have a cancer, is that always related necessarily to your initial prostate cancer, or could it be another cancer? Or what is
Yeah, if your prostate's been removed, it's pretty easy to see if your cancer's come back, because your PSA should basically be 0 or what we call undetectable. And if the PSA starts going up, cancer can behave in funny ways sometimes. So a lot of times what could have happened is there could have been a cell that's already floated off somewhere, and it's sitting there quiescent, meaning it's not doing anything. And then some sort of something kicks the cells into gear, and they start growing and multiplying. And prostate cancer is unique. There's not many cancers that give off something that we can detect early, PSA. And so most prostate cancer cells make PSA, and that's why we get checks, even years out, just once a year check. And so that is probably related to the original disease. It's probably cells that have broken off.
PSA is stage 0, and you get that form of cancer that's not related to your prostate, or I'm just curious.
Yeah, then it would be totally different, non-prostate cancer.
But that's when ProVeg would come in at that point, if you did have a high PSA and you got your cancer back.
ProVeg, eventually, they're looking at giving it earlier and earlier, because the thought is your immune system works better the healthier you are. So why not give this kind of drug earlier? So they're looking at giving it as soon as, eventually they're thinking, maybe we don't need surgeons, we'll just give this and no one will have to have any kind of treatment. But they're a ways off from that. Right now, it's only approved if you've had cancer that's failed hormonal treatment. So for a person, let's say you have surgery, your PSA starts going up. Well, then the next step sometimes is or radiation. It could be radiation. Let's say that fails, PSA keeps going up. A lot of times at that point, we'll just kind of watch things. Eventually, you can start hormone treatment where we try to do castration. And if castration fails, the cancer starts to spread to the bones. And that's when you'd be a candidate for cartilage.
It's very advanced, then, basically.
It's considered, yeah, it's a different category.
So earlier it stated that the blood's drawn out, and then in the lab, your immune cells are introduced to cancer cells. Is that your cancer cells it's introduced to, or what?
Great question. The cells that it's introduced to are present in 95% of prostate cancers. They're not your own prostate cancer cells. It's your blood being exposed to it. So that's why it's kind of personalized, because that way you're not going to reject your own blood when it's given back to you. But the cells that your immune system is being triggered to recognize are not necessarily present on all prostate cancer cells. That's why it doesn't work 100% of the time. But the cells that they've picked are on 95% of prostate cancer cells. APC, PAP is the antigens they pick. I think what's going to happen, and what I've already seen, is that there are other companies that are working on their own so-called vaccines, and they're picking more cell lines, and they're trying to figure out ways to even take tissue biopsies from you, the patient, and isolate those prostate cancer cells, and then allow this reaction to happen outside of the body. That seems to be the key thing, is if you bring your cells outside of the body, there's something that the prostate cancer cells are doing where it's preventing your immune system from normally reacting how it would.
And so that would require another biopsy to obtain your own
So you would,
cancer cells, yeah.
right, like if they had a bone metastasis, you would take tissue from that bone metastasis. That's how they're doing the studies.